It's a pleasure to talk to you today. It would be even greater a pleasure were I in Melbourne. I was last in Melbourne, I think November 2018, and had good conversations with people at Vic Health and in the state government and others. So I have a good feeling about what happened in Victoria and in Melbourne. People have been buying Camus' The Plague. In fact, it's rumoured that sales have experienced exponential growth, like the virus itself. And in The Plague, Camus said that the plague is blight and revelation. It brings to the surface the underlying corruption in society. Perhaps corruption is too strong a word, but I've been arguing since COVID-19 happened that it exposes the inequalities in society and amplifies them. If you'll forgive me, I'm going to talk about Britain. Sharon Friel and Fran Baum have done an excellent paper on inequalities in health in Australia and the effect of COVID-19. So I'll talk about the British data, but I think they have relevance for Australia. In February this year, I published the Marmot Review 10 years on. February. Feels like another era, but it was just before the pandemic smashed down upon us. In 2010, I published the Marmot Review, looking at the causes of health inequalities in England and what we could do about them. And we identified 6 domains: early child development, education, employment and working conditions, having enough money to live on, healthy and sustainable places in which to live and work, and taking a social determinants approach to prevention. The 2020 review looked at what had happened in the 10 years since my original review, and it was not a good picture. Life expectancy in England, which had been improving about 1 year every 4 years for 100 years, in 2010-11 slowed down dramatically. And in fact, the rate of increase in life expectancy more or less ground to a halt. Second, health inequalities continue to increase. There is a social gradient by level of deprivation of area of residence that got steeper since 2010, and the regional inequalities got bigger. And third, life expectancy for women in the most deprived 10% of areas outside London actually went down. Wow, this is really not supposed to happen. We're used to health getting better all the time. And I've been arguing that health tells us something fundamental about how well a society meets people's needs. And health inequalities tells us something fundamental about inequalities in society. So if health has stopped improving and health inequalities are increasing, something's going wrong. And I commented, we lost a decade. Now, what could have caused this problem? Well, we had a new government elected in 2010, and the question is, are they responsible? Difficult question to answer, because this is not a controlled experiment. But the government that came in 2010 had as its principal reason for being austerity, to cut the deficit and to cut the debt, to reduce the size of the state. And that they did. In 2010, 42% of GDP went on public expenditure. And by 2019, that 42% had gone down to 35%. And that rolling back of the state had been done in a very regressive way. In the least deprived 20% of areas, local government spending per person went down by 16%. And in the most deprived 20% of areas, it went down by 32%. Clearly regressive. The greater the need, the greater the reduction in spending. And in each of those domains that I mentioned that were in the original Marmot review, things got worse. And it's likely that those changes, the rolling back of the state, the regressive nature of reduction in public spending, and the interruption with policies in those domains, it is likely that they were responsible for the stalling of life expectancy and the increase in inequalities. So that when the pandemic crashed down upon us, we were not well prepared as a society. And very soon, when the data started to come out, the myth that the pandemic was a great leveler was shown to be a myth. Mortality from COVID-19 followed the social gradient. The more deprived the area, the higher the mortality from COVID-19. And the pattern looked very similar to the pattern of all-cause mortality, which suggests that the causes of inequalities more generally, health inequalities more generally, overlap with the causes of inequalities in mortality from COVID-19. The excess down the bottom was a bit bigger for COVID-19, and one distinguishing feature that was different was the high mortality in Black, Asian, and minority ethnic groups. More than half of that excess mortality in BAME, Black, Asian, and minority ethnic groups, could be attributed to deprivation. I was on the BBC, and a senior government person was asked about this pattern. He said it was terrible that BAME groups had high mortality and they should wash their hands and practice social distancing. And I was asked what I thought about the high mortality in Black British, what we should do, and I said we should deal with structural racism. Yeah, but what should we do tomorrow? Tomorrow we should deal with structural racism. Start right now. Does that have echoes in Australia? The inequalities in the non-Indigenous population, but the high mortality in the Indigenous population, that is attributable to structural racism. So what happens now? How do we build back better? Well, the first thing I've been saying in Britain, whatever we do not want to go back to the status quo. And second, a lesson from the pandemic is no more austerity. The government said they will spend whatever it takes, right? No more austerity. That was really damaging. But the other crucial point is to do with the climate crisis and sustainability. If we want to build back better, if we don't simply want to re-establish the status quo, then we have to put the climate change agenda and the health equity agenda together. I'm part of a global sustainable health equity initiative we launched on the 2nd of July with Director General of WHO Tedros, Michelle Bachelet, the UN Commissioner for Human Rights, speaking at the launch. We had more than 100 global organizations that signed up to this initiative. And we're pushing something similar in the UK, a sustainable health equity initiative for the future. Should we be simply seeking to get economic growth back on track? No, that's not the future. The future should come from what the New Zealand Treasury did, to put well-being at the heart of economic policy, create the conditions for people to have the capability to lead lives that they have reason to value. lives